I'd love to welcome Jeremy Lim. He's the CEO of a very interesting startup, AMILI, that Jeremy is going to tell you about. Why don't you tell us a bit more about AMILI, about the startup, what you're trying to do, your progress so far, and how you'd like to see it emerging in the future.
We have always known that our guts are filled with microbes, or more accurately about 100 trillion microbes, and we never knew how important and how useful they were in human health. The microbes really play such a big role in our brain health, metabolism, immunity, and all of these. And that's really why the microbiome has been described as the most important medical discovery in recent decades. We spoke to a lot of people. After 6 to 9 months, we decided that this was scientifically very important to do, and we could build a business around it. And so AMILI, which is a compression of 3 words, Asia Microbiome Library, was then born. We are building the world's largest multi-ethnic Asia database as well as biobank. In 3 to 5 years' time, we hope that AMILI will be recognized as an innovation engine, partnering across the ecosystem in food and biotech to create microbiome-based interventions, both in the diagnostic as well as in the therapeutic space.
Why don't you share with us your thoughts on, how you see genomics and other biological advances colliding with the world of, let's say, health insurance. So we're all thinking a lot about AIA, our shareholder, our parent, and its health insurance companies, how we can support them.
If we take the health data, the traditional metrics around blood pressure, lipid profiles, whether you smoke and all this, marry them with what in the public health lingo is described as the social determinants, right? And then look at other emerging factors like the microbiome. Then the question is, how do you bring this into underwriting? And much as I think the microbiome is important, I think the whole person is even more important, and that the future is going to be what in the medical lingo is described as multi-omics. We look at the genomics, the metabolomics, and all the other factors to then come up with a composite picture. And that will help in not just underwriting, but after you've decided to take the individual on as a policyholder, you can be much more specific in how you intervene.
As we look around the region, you have many countries here with quite a few barriers between them. The different regulations, data privacy, sometimes language. What's your view on the ability of let's say, digital health startups to scale, given that, even a country like Singapore, you can get reasonably big here, but then you've got to move to some of the neighboring markets?
In the consumer health space, I do think that there's tremendous opportunity. I suspect that the sky's the limit, more so than in the US, because you're competing often against nothing.
I think from our conversations, and you've probably read a bit, why don't you share your thoughts on with us on how you see the prospects for a health tech and solutions business like we're building, in the region?
I think that the future is very, very bright, Johnny, for a few reasons. One, almost every government, almost every large employer is now looking for value. The glory days of just spending because GDP growth was at 8-9%, those days are over. So people need to look at revenue as well as cost, right? And so healthcare costs become a critical factor that needs to be controlled. And the sort of skill sets that Amplify Health brings are fairly unique, especially at scale. So if we look at how the world is moving in this, and particularly here in Southeast Asia, lots of the emphasis initially was on growth at all costs. Now that the insurance or the payer sector is starting to mature, it's now gone into cost containment, and the low-lying, or I won't say the low-lying, but the obvious places to start will be in fraud, waste, abuse, and that's what from your pedigree with AIA and all, you are very good at. But you're also very strongly positioned for the next frontier, because beyond fraud, waste, abuse, beyond efficiency, you also need to start moving into population health and keeping the lives under management as healthy as is possible. So you have all the right pieces. Fundamentally, we need to control healthcare costs, we need to drive value, and we need to start this really population health journey. So you're in a good place.
Jeremy, thank you. I must say you've set a very high bar for for the series that we hope to run on a monthly basis. It's been a privilege to listen to you. You're very unusual in the span of your knowledge and understanding, and it's been a pleasure.